From the Psych Hub Podcast Network, welcome to Coming Back Better, a podcast sponsored by HCA Healthcare and in collaboration with Columbia University Department of Psychiatry.
Welcome back to another episode of Coming Back Better. Hey, Marjorie.
It's great to be with you again, Paul. I love this episode because I can so relate to it. Burnout. We're going to talk about burnout, the pandemic. Did it cause burnout? Did we have burnout before? And it is such a popular topic.
Burnout. Researchers say that stress and exhaustion among office workers has worsened during the coronavirus crisis.
So the pandemic has clearly highlighted the physical and mental toll of chronic workplace stress. A recent study by Infinite Potential found nearly 35% of people across 30 countries are experiencing burnout.
Burnout among doctors could cause a shortage of physicians by 2034.
Looking at women and men in an Asana study, 67% of women, 59% of men, 63% of all employees experience burnout. Sadly, 40% of workers believe burnout is an inevitable part of success.
Wow.
This affects everyone, and this episode is for everyone. But first, we're going to hear from someone in healthcare that was working during COVID and is still dealing with burnout now. He's incredibly vulnerable when he shares his story, so we're not even going to mention his name. He's very courageous, and he does a nice job really setting the stage for us of what it was really like during COVID.
You've captured my attention. I can't wait to listen.
I'm a hospitalist and a junior faculty member at an academic medical center. I've thought a lot about burnout. It's something that I've dealt with chronically throughout my career in medicine. It started when I was in medical school, the stress and the anxiety that comes with such a highly competitive environment. And, I was burnt out before the COVID-19 pandemic hit when I was an intern. It's come in waves and fluctuations in terms of how bad my feelings of burnout have progressed. In terms of specific experiences, it's hard to pinpoint. I think there's a lot of factors that have led to feelings of burnout. But I do worry that in recent times, I've noticed that there's a lot of media attention surrounding the COVID-19 pandemic and how it seems to have been portrayed as if it's leading to more burnout amongst medical providers. Because in reality, I think burnout existed at epidemic levels prior to the COVID-19 pandemic and continues to be present even now that we've gone through what seems to be some of the worst surges of the COVID-19 pandemic around the world. And I think it's a multifactorial process. I think part of it has to do with the constant pressure and microaggressions that all of us face as healthcare providers that come from interacting with each other in certain ways, and then also how we interact with patients. And another part of the burnout has to come with so many of us providers not feeling like the work that we do is in line with the values that we initially had set for ourselves. And much of that has to do with, our day-to-day tasks that are not so much related to providing medical care and helping others, but to spending hours and hours a day on documentation, trying to address social needs that are beyond our scope of abilities, and being used in a sense by the health system as a whole in order to keep it going and make a profit. And I think each one of us faces that in our own ways throughout our daily work life. And those are the things that really cause stress, at least in my practice on a daily basis. The COVID-19 pandemic obviously came with a lot of suffering, but in my time during residency, after treating lots and lots of COVID patients, I were very acutely ill in the hospital, and many of whom died and under my care and the teams I was working with care. I never really felt that level of suffering caused me to feel disillusioned or traumatized to the point that I couldn't keep going. In fact, it was a privilege to be able to care for people and be a witness to the suffering and do my part to help alleviate what I could. But I think the COVID-19 pandemic flooded our inadequate health system and put an extra burden on all the things that create burnout, like I mentioned, some of them, which include the EMR and the time spent doing non-medical work like documentation and things related to billing. And I think exacerbated those elements of the health system, which cause medical providers, whether they be physicians, physician assistants, nurses, across the board, to feel overworked in things that really don't align with our values and our individual missions as providers. With that said, I think also with burnout being so pervasive amongst all providers, I think that the tense work environment is very palpable. I trained in the safety net. I now work in the private sector, and regardless of the circumstances, the context that I work with, one thing that's a constant is this cynicism amongst all providers that feels fairly pervasive and hard to get away from, and really clouds some of the joy that comes with taking care of people. That's ultimately what makes me very sad. More than anything else is that many of us went into this career not thinking that we were going to be doing so much work that wasn't in line with our values. And in terms of what I do to circumvent burnout or try to minimize its effects on my health, both mental and physical, as much as possible, I use my hobbies like soccer, spending time with my loved ones, and talking about the things that I struggle with my partner, who's very supportive, and the people that understand what I'm going through. And usually when I speak about things candidly, I tend to get support back. And that's the most important thing. But I don't think these other measures to try to minimize burnout actually tackle the root cause of it, which is working in a system that doesn't align with our values and is at the whims of a for-profit and money-making system.
Marjorie, wow. I heard the pain in his voice, and something that really stood out to me. Well, a couple things. One, that, burnout was around long before COVID, and COVID just made it worse. But also, I'm hearing this tension between we're called to do the work of different types, in his case, healthcare. He finds that he can't necessarily live his values out in his workplace and in his work, and how that really drives this experience of burnout and question and doubt and suffering.
It's really profound. And I think we can all kind of relate to him as he's talking. What I think is so interesting is that he feels like he's had burnout since medical school, and that it's really been there all along, and it just kind of continues to get bad. And when you start thinking about the different things that create burnout or build onto it, thinking about all those hours that healthcare providers spend on documentation when they're not actually treating patients, then they end up doing
other
things.
Stuff.
Yeah, exactly. That had nothing to do with the scope of why they went into the field or what their job is, also creates burnout.
You know what really spoke to that point was how the assumption is all the suffering and death that occurred during COVID, he doesn't speak to that making things worse. Almost that gave him a chance to come back to his mission of healing and ending suffering. So I think that really highlights the point that it's all this extra stuff being piled on, taking him away from what he wants to do.
It's sad to sometimes feel like you're being used by a system.
Mm-hmm.
Then you see all the suffering and the death, and we put a lot on our caregivers and our healthcare workers. But again, we hear stories about how people use their hobbies, like for him was soccer, and talking to loved ones to kind of minimize these different effects.
Well, Marjorie, I want to give some hope here. And I had a chance to talk to 3 experts from Columbia. These 3 experts from Columbia were just fascinating to really get a sense of what do we know about burnout in a broader context, because it affects everyone, every industry, these factors that drive burnout. And so the 3 experts I spoke to, Claude Ann Mellons is a clinical psychologist with research and clinical expertise. Dr. Laurel Mayer is an associate professor of clinical psychiatry at the Columbia University College of Physicians and Surgeons. Erin Engel is a licensed clinical psychologist and a clinical director of Columbia University Psychiatry Specialty Services.
Paul, I'm so interested in this topic. I can't wait to hear what these experts have to say.
Well, welcome now to Doctors Mellons, Mayer, and Engel. Burnout is something I think we all can appreciate to some degree, but especially coming out of the pandemic and COVID. So thank you for taking time today to speak with me and for us all to learn more on this topic. And I always want to make sure that we're not assuming sort of a common definition. So if we can start out with what is burnout?
Yeah, thanks, Paul. Thanks for having us today. So, burnout is a common term that's often associated with sheer exhaustion following exposure to extreme and chronic stress. So, although it's natural for most of us to experience some degree of stress at work, burnout, in the case of a professional context, is about enduring a level of stress and a degree of stress that typically exceeds one's coping resources.
Okay.
And one experiences it without any breaks. So, this is day in and day out exposure to extreme and unrelenting chronic stress. And originally, burnout was described in the context of the helping professions. So, these are things like police, firefighters, teachers, other professions that involve self sacrifice or people serving others, for example, our healthcare workforce. And typically, though, burnout can affect anyone experiencing extreme levels of stress at work.
Stress is something we all encounter, but this is not the same as stress. This is something exceeding that or more than that.
Yes, exactly. So typically, what we see is that this exposure is about extremes. So that can be in terms of extreme workloads. So, in other words, where a person has very intense work demands, even their activity levels, whether they're underworked or overworked, and also stands to impact to what degree one experiences meaningfulness in their work. So these are extremes that often leave us feeling empty, burned out, or even unable to cope.
Yeah, if I could build on that, thanks for starting us off, right? Some of the classic symptoms of burnout, and burnout, as Dr. Engel said, is really a work syndrome construct. It's not a mental illness, it's not a medical diagnosis, but it is something that happens in persistently stressful work occupational environments. And it's categorized really by three main buckets, if you will. There's an emotional exhaustion, often coupled with a physical exhaustion, but it's an emotional exhaustion, that sort of giving all day and not really being able to catch up. There's a depersonalization or a cynicism, sometimes asked as, have you become more cynical since starting your job? Some of us may be naturally snarky. That's not what we're talking about. Sort of a persistent snarkiness, irritability, and cynicism that just becomes part of how you see your work and work environment. But to me, the third criteria really is this perceived low personal accomplishment. People that get burnout are not people who can't handle a lot of work. Often, it's actually people who can and do manage heavy workloads day after day. But what happens over time in the insidious nature of burnout is that you feel like no matter what you do, it kind of doesn't matter.
Okay.
And you keep working and working, and more fills its place. And the work that you do either seems purposeless, meaningless, not of much value. And I think that's the piece that really gets at people and is really a core of burnout, that no matter what you do, it just doesn't seem to matter anymore. And it used to matter a lot.
I almost get the impression of someone may try to work even harder towards that place of purpose and meaning, and actually you're just at that point spinning your wheels. Is that the quality it takes on?
Exactly. It feels like you're spinning your wheels, but you've also led to, and we'll talk more about this later, I'm sure, but one of the ways to address burnout is trying to reconnect with the meaning of your work.
Okay.
It's really when you've lost that meaning, when the day-to-day grind of the job has you so removed from what connected you to the job in the first place. That's what burnout is.
How might someone begin to notice it's losing meaning?
I think it's a great question, and one that actually is also going to lead me into, some of the symptoms of burnout actually overlap with the symptoms of depression. And so that's really important to know. A lot of us think there's stress on any job, so I'm just going to suck it up and do it. It's just part of the job. Isn't everybody's job stressful? But it's when things that used to bring you joy or things that you used to remind yourself like, oh, this is why, for me, this is why I wanted to be a doctor. When you have many fewer of those moments, that's something to pay attention.
Okay.
Sometimes it's hearing your colleagues around you, right? And it's noticing it in someone else and then reflecting, hey, I feel that too, and then wondering. And sometimes when it's actually depression that's sort of sapping the meaning, having you feel exhausted, when you start to feel hopeless about things or start to despair about things, that's when actually we think we've crossed into even a different level and really a different diagnosis, which is depression.
Yeah, and I'm hearing this sense of things in the past that would have tapped into that place of excitement or meaning or purpose. They're still there, but I'm not tapping into that anymore.
That's right. Or it's not doing the same thing it used to.
Okay.
Right. It used to be that coming home at the end of the day and seeing your kids, like when you walked in the door and your kids run up to you and give you a big hug, that used to be like the best part of coming home. And certainly for many working parents during COVID, if you were even able to come home at the end of your day, having your kids run and jump on you was just more exhausting. You felt like you were coming home to your second job rather than coming home to your family.
Okay. But that's where I'm hearing the difference with depression as far as that lack of meaning or purpose, that's a pronounced, stark difference as opposed to just low energy or I'm just tired and wrung out.
Yeah, and in depression, there are fewer experiences where you can tap into the meaning. Burnout is primarily related to work. So if you were able to take a week's vacation, you might actually feel much better on vacation because you're not at work.
Got it.
If
Okay.
you have depression, you might feel a little better on vacation because just less stress makes things a little bit easier, but you unlikely would feel well at the end of that vacation. And that's a little bit the difference between burnout and depression as well.
Yeah, as far as the pervasiveness of depression and how that's different. Okay, that is really helpful. Anything else on symptoms for our listeners to get a sense of almost, okay, does this apply to me or not when it comes to burnout?
I think it's really important to remember that these symptoms can be very subtle.
Ah, okay.
They can be very subtle. If you're, again, I'm going to go back to the working parent issue, not to reveal something about myself. The working parent feels tired all the time. So if I come home at the end of the day and I'm tired, I think, oh, well, it's just because I worked all day and now I got to take care of my kids and make lunch for tomorrow. So, oh, I'm just tired because of the things I have going on. Whereas really it's something more than that. It's something deeper than that.
Yeah, I'm getting the frog in the pot metaphor here. You don't realize how deep you're in until you're really in.
In the very beginning, when the three of us, in addition to 10 other people, were working around the clock with the program we'll talk about later, I ended up in bed for 3 days, really sure I had COVID and did not have COVID. I was so fatigued, I couldn't rally, and shut down. And it really took me a little bit to get back. The only thing that I was going to say also, and Laurel will talk more about this later, is just the extreme exhaustion, I think, too, that can come with this.
So it really can cross the threshold from emotional to a physical experience as well, sounds like.
Yes. There's also the depersonalization piece, the cynicism piece. That also, it's when it becomes pervasive.
Okay.
We know that no big system, no big corporation, no big hospital system, nothing works efficiently. But when we're sort of doing okay, we tolerate the inefficiencies. We tolerate someone snapping at us. We tolerate someone jostling us on the subway, and we're New Yorkers, we don't pay attention on the subway. But when you have burnout, these things you start to notice them and not be able to let go. A crowded subway becomes really annoying. Not being able to get a seat or having to touch a nasty pole on the subway to hang on, like that's just like, can you believe it? How come, the mayor can't clean up this city? When whatever it is, it's things that you otherwise might not have even noticed or would have rolled off your back. They become things that you start to complain about, be irritable about.
Right.
That's a sign of burnout.
The window of tolerance shrinks. You get stuck on things. I hope this doesn't come across the wrong way, but you become that person in a sense. I used to talk about that person. Now I am that person. It seems like it has kind of that quality to it.
That's right. And sometimes it's sort of a stark reality, like, ooh, I've become that person.
Yeah.
You didn't notice that it was happening until something that kind of really jolts you saying, oh, that's not what I'm usually like. Gosh, am I like this now?
Well, let's use that as a lead-in for what are drivers? individual, organizational, societal? How do we end up in that place that you're speaking of?
So I think as much as we all wish that there was one driver, one specific problem, that if we could just fix that one specific problem, it all go away.
Yeah, just the one thing.
It doesn't exist.
Okay.
There's not one driver, there's not one cure, I think going forward, but rather this is really something that individual, social, societal, organizational factors all really influence. And there's been a lot of work done in this area for a while now, a lot of it driven by Dina Maslach and others, such as Tate Chanefeld. And we thought we would just highlight a few. There are many factors that have been put out there. There are 7 or 8 that have been really focused on. And Erin already started to talk about workload. When you have a manageable workload, it provides the opportunity to do what you enjoy, to pursue your career and your objectives, and to develop professionally. And people can work very hard when there is a kind of the right balance. But a crisis in workload, when it exceeds your capacity, can lead to burnout. That's chronic excessive workload that Erin, I think you made reference to before, that we saw in helping professions. And it makes it that you don't have time to rest and recover and actually bounce back from it. And when people perceive that work is now going outside of their usual tasks, so now they have a ton more administrative tasks, for example, or things that they don't feel qualified to do, they can start to feel burnt out. And I think we've seen a lot where organizations are being asked to do more and more for less and less. So workers in general, fewer and fewer, are being asked to do more and more. And so it tips the scale. So that's workload, which is a key factor. Control is a second really key factor. Right. So there's decades of research, that show that workers' sense of control at work is really a powerful factor in predicting their health, well-being, and burnout. So workers who lack control in the workplace or feel like they have little say as to what tasks they have to accomplish, how they have to accomplish them, and where, will start to feel more burden. And they'll start to feel like their professional autonomy is at risk, and this can lead to them being disengaged from their job. And a lack of control includes flexibility, right? And if you don't feel like there's any flexibility and you have no autonomy, it can also affect another factor that's important to burnout, which is really work-life integration or work-life harmony. So if you have a lot of responsibilities outside of work, Laurel was talking before about taking care of children, but it also might be taking care of parents or others or significant others. And that balance can really be out of control. And that also leads to burnout going forward. Third area is reward. So we know that a meaningful reward system acknowledges our contributions to work. It signals we're of value to an organization. Often we think, many of us, at least in this country, think about it in terms of financial rewards. And financial rewards are important. I do not want to minimize them, but they're not the only thing. So when we feel like we're not valued, our contributions aren't valued, that we're not really recognized for what we do, that can also be associated with burnout going forward. I was just reading the Surgeon General's report on mental health and well-being, and that report talks about mattering at work as being a critical component of well-being. So the flip side of that is when you don't think you matter, that it's associated with burnout. Related to that is community and connection. People thrive when they feel like they're supported and their connections to people. Lack of support and trust among coworkers can go the opposite, right? It can contribute to workplace conflict, and it can lead to some of the exhaustion and depersonalization that Laurel and Erin have talked a little bit about before. Organizational environments also, I think, are, increasingly understanding that this is where equity and respect for others is really critical. And when the environment is not perceived as being equal or fair or transparent, that also is associated with burnout, that some people get things that others don't, or there isn't a consistent way that rules are applied, or rules are made up behind closed doors. So it doesn't feel fair. It doesn't feel equitable. That's all associated with burnout. And then just two more values. And I think, Laurel, you may have, or Aaron, one of you made a reference to this. When there's dissonance between an employee's values and their perceptions of what the organization's values are, that can feel terrible and can also lead to burnout going forward. Lastly is lack of opportunities for professional growth and advancement. I think we all feel like we want to grow, and when employees feel like they've hit a dead end or there are no opportunities for them, that also adds to burnout. So you can see there are a lot of factors here that make this worse. And I'm sure Aaron or Laurel could think of some more.
Well, I think what's important to state, actually, and Claude, I loved the list that you just went through, because what you were highlighting is when they don't work in concert, it leads and contributes to burnout. But when they do work together, when they do work in concert, it leads to engagement, enjoyment and engagement and vigor at work. So it's not that there's one thing that causes burnout, but it's the balance of those drivers, if you will, that when sort of too many are pushing in the negative direction, we feel depleted and not valued. You don't matter. I like that, mattering at work. And when they're more in a positive direction, we're energized, we're excited, we're engaged, and we can do even more.
I do wonder, and I'm guilty of this from past work that I've done where, brought into a company to teach about self-care and resiliency. And I didn't hear that on the list at all. If you can speak to that a little bit about sometimes where the company thinks the solution is versus what the solution really is.
I think as both Claude and Laurel alluded to, right, one certainly impacts the other. So healthy individuals make for healthy communities and vice versa, right? So everyone has a responsibility when it comes to well-being at work. That said, there is a particular emphasis, I think we all heard during the pandemic, take care of yourself, devote extra time to self-care. At times, I think when we're talking about this with our patients, right, or excuse me, in the work that I do clinically as a psychologist, sometimes it's tempting to sort of eye roll, right? Some of the things that we can do to care for ourselves, whether that's exercise or spending time with our loved ones, again, reaching out to our supports at work. But ultimately, it's going to be the combination of both individuals and systems, both striving to care for ourselves and each other better.
Aaron, just to pick up on the thread that you were talking about, right? There has to be individual sort of bottom up approaches and also systems top down approaches to be able to meet this challenge of burnout. Yes, yoga, meditation, self care, in whatever way self care means for you, is important because healthy individuals make up a healthy community and communities can support the individual. So we need all these. We need it in multiple directions. Relationships are often bi-directional. Burnout's when a relationship is a little bit off the rails. So we need to address it bottom up and top down.
So if an organization is encouraging self-care, great start, but not enough. The organization has to look at itself too.
And some of these self-care, it's not all yoga and meditation, but self-care in an organization can be, you have an employee who needs time off to go to a funeral. Sure, the work still happens, but it is important for that individual to be able to easily be able to take the time off to grieve for whoever the loved one was and not have to go through multiple paperwork or multiple emails or have a hard time or it's got to be PTO or it's got to be this. There are maternity leaves, paternity leaves. These are ways that help an individual take care of themselves, but are institutional in their design.
Organizationally, how do we reduce the barriers to take those actions? That's really important.
And I think that we learned pretty quickly, while people liked the messages around self-care and resiliency and growth and how do you grieve and how do you cope with loss and illness, at a certain point, they don't want to hear that anymore because it feels like you're just trying to figure out how to make us run faster. And so if they hear that the system is also trying to support them at the same time that they're being asked to engage in some of these activities, it's a hard message.
Working harder and faster because I feel better doesn't solve the problem. I mean, it does seem like headlines every day about burnout. And is something changed or are we just more aware of burnout, that it seems to be everywhere now?
Yeah, that's a really good question. And I think it's both.
Okay.
Right? I think that it's just something we've experienced, but actually over the past 10, 15 years, certainly in the healthcare world, we've learned more about the prevalence of burnout, but also the consequences of burnout.
Okay.
Burnout has professional consequences for physicians with burnout. There are higher rates of turnover. That costs hospitals actually a lot of money when they lose clinicians and then have to hire new clinicians. There's data that burnout may be associated with decreased patient satisfaction or more likely to make an unforced error, if you will. And no patient wants their doctor to make a mistake. No doctor wants to make a mistake, but we've actually data suggest that doctors with burnout are more likely to worry also that they've made a mistake or it impacts their patient care attitudes. Again, the ways in which burnout manifests professionally may differ based on the profession, but we now have data that the burnout is not just something that someone, deals with individually and it doesn't affect what they do. In fact, the impact of burnout leaks out into the work that we do. And there are personal consequences to having burnout. Broken relationships, it impacts relationships. Increased use of substances, turning to alcohol, turning to other drugs to self-medicate, self-regulate the cranky, burned out feelings that you have. As we've talked about before, there's a relationship with depression. And for some of the literature, there's even a link with burnout, depression, and suicide. So these aren't minor annoyances. These are real things and significant consequences that we're now aware of.
What I'm hearing is things may have been brewing before COVID, but now how has COVID further impacted burnout?
I think for one, people are less willing to actually really sacrifice their health, their families, their communities. And so I think in part that's why we're hearing a lot more about burnout. I think decisions are being made given the past few years and some of what everybody experienced.
I was just thinking about our experiences, in the community during that time, right? And it was the perfect storm in terms of stressors, right? And how those stressors synergistically impacted one another. I mean, especially for our frontline colleagues, right? There was at times the need to care for the critically ill. Those patient volumes in New York City were incredibly high. In some cases, even the most competent and capable physicians and healthcare workers were challenged by a new illness and how to best treat it. I think, as we know, during those early days of quarantine, isolation, in some cases, again, our frontline colleagues unable at times to go home to be with their families or to be with their supports. It just created isolation combined with intense, prolonged stress. We just weren't sure at the time how the story would come to an end. I think, again, on the other side of this is also what we know to be true in terms of what leads to reduced burnout, right? And being able to talk openly, to get support, to have validation from others that this is a shared experience, even though we all have our individual stressors that we're navigating and did navigate during the pandemic. Ultimately, when we're recognizing that community brings solidarity, and certainly we saw this in our medical center community, it did help to have safe spaces to disclose, to normalize what was happening, and to talk about it openly.
And I definitely hear you speaking to, and this has been a common topic, that disruption can be challenging, but it also creates opportunities. That's what I'm hearing you speak to is there's some opportunities coming out of this. And I also do wonder, I've heard it labeled great resignation, great reshuffle, quiet quitting. I'm thinking there's a connection here. What's the connection between that trend of the past few months?
I think that's what I was trying to get at also with people are unwilling to sacrifice their well-being now. And so I think that's what we're seeing, right? People are leaving when it gets to be too much or when they're feeling burnt out where they are. I think there's the realization of things may be accelerated too much, particularly for some professions. And now there are a lot more choices out there. And I would throw out two other things that I think maybe also played a role because COVID wasn't the only thing that happened in the past few years, right?
Good point.
Huge political disruptiveness. There were huge issues around the vaccine and politicalization of the vaccine, if that's a word, and clear racial and social injustice, not just the murder of George Floyd, but many others and many anti-Asian violent acts. that have really made it that enough is enough is, I think, how many people were feeling. And I don't want to tolerate this anymore, and I don't have to tolerate this anymore. But that in itself led, I think, many organizations to actually think about racial and social injustice and diversity, equity, and inclusion, including our organization. And so I think that was the opportunity. If you hit rock bottom, it then inspires moving up.
Right. Well, thank you for bringing in that there were so many dynamics at play. And, I'm really getting a sense of, as we come out of the pandemic, I'm not going to use the word post-COVID because I don't think we can make that statement yet. But this is like an organizational imperative that if you want to attract employees, you got to do something. I'm curious from your research and your work, this is where we come to the hopeful portion of the interview. As far as what's the hopefulness, what can we do differently to learn from this and do better?
The three of us can answer this in different ways. And maybe I'll start how the three of us came together as something that an institution can do, because I guess we actually knew each other, but we weren't so closely working together before. As a result of the pandemic, I think we said to you that we started to work with frontline providers. And in part, that came from a call from department chairs to our department chair at the time, and also to our vice chair of clinical services. We need psychiatry to be doing something for the frontline providers. So we brought together about 10 to 12 of us, psychiatrists and psychologists, to quickly try and put together a program. And we knew there'd be a lot of stigma around mental health, around being vulnerable, around asking for help. We didn't talk about asking for help, but that is not an easy thing for many people to do, particularly physicians.
Right.
And so we put together a peer support program. So although we are all quote unquote trained shrinks, we didn't come in as shrinks. We came in as peer supporters with a really quite simple model of giving people the chance to talk about what was challenging or stressful, and then quickly helping them identify coping strategies, self-care strategies, peer support strategies that Erin can talk a little bit more about going forward. And I would say after we did this individually, but also in groups within a department or a division, we very quickly figured out that frontline providers were not the only ones impacted by this pandemic. To quote Laurel, we were all on the front lines of this pandemic.
Well stated.
Some more than others. And so we started offering this to departments and schools across the university, mostly in the form of town halls and webinars on important, organizational topics.
From what you were referencing, Claude, with our work with Columbia, I think one of the most meaningful parts of our work, I hope I can speak for this group here, was, getting a chance to meet colleagues, our peers, staff, students, faculty across our academic medical center. And we had the opportunity to ask people, what matters? What do you need? What are you going through? How can we help? Even without perfect solutions, I think, again, thinking about the importance of camaraderie, of community, right? By even asking the question, we were starting to think together about more effective solutions, and that decreased isolation. And that was a really important point. To speak to that further, partnerships are so essential. And this is partnerships amongst team members, right? For those of us who are fortunate to be part of teams in whatever kind of work that we do, when we're with our colleagues or in safe spaces or with people whom we trust and can communicate openly, we're ultimately able to feel more supported and less alone, and then to solve problems and think about what kind of solutions, we need. And I think partnering with leaders is also a really important component here, right? Because leaders certainly are not immune to stress. And when we think about the interplay of how employees are affected by their leadership and leadership by their employees, keeping an open dialogue and partnering to think about how to solve the on-the-ground problems becomes essential. So I did mention earlier about connection and, of course, care for each other, but also self-care. A point I'd want to make here is that it is necessary, right? To care for ourselves is not a luxury. And I think sometimes we confuse those things. Sometimes I hear that about therapy, for example, that it's a luxury. It is a privilege. It is a wonderful thing to be able to access care. And in the absence of that, again, keeping the lines of communication open and thinking about meaningful culture change, right? What can we do as an institution, as a collective, to continue these important conversations that were had around racial and social injustice, or how to better tackle mounting work demands, or how individuals on a team can support each other so that they can effectively take time off without having to worry about picking up the slack or extra demands becomes really important.
I think that if I could follow that up or emphasize the point, if it's okay, part of our approach was harnessing the power and the creativity of the community. Not that we need to generate our own solutions, but each person has something to contribute, and leadership that is open to hearing from its employees, hearing from its community, may find that they have a solution or a suggestion that can be very useful. And having leaders who are leading, but are also real and acknowledge that we're all in this together, and no one person has the answers, but I have your back. That helps us through. And, where Claude said, where we can be flexible, even this podcast, little secret, we're not all in the same room. That's a consequence, a positive consequence, actually, of the flexibility that we needed when COVID happened to be able to do our work remotely. We've learned who needs to be and who benefits from being in person, and sort of what can be done in a different way. And to me, that's one of those silver linings of COVID and of the pandemic that will change the way I do my work.
It just brings me back to appreciation and how essential it is, right, for everyone, leaders, employees, teams, to be mindful of gratitude and its essential role in helping to highlight value, right? And for each individual to truly be seen, right, as far as not only their productivity, their important work contribution, but who they are as a person. And I think one of the unique things about Columbia, too, was in gathering different teams and folks across disciplines or specialties, we got a chance to hear a bit about how they support one another, what they're appreciative for, and in some cases, even practice mindfulness together, which is something that wouldn't typically happen. So, again, I think this is a great example of how adversity creates space for opportunity and change and growth.
There's one thing I want to make sure we acknowledge. If I'm with an organization that did learn from this, they are doing the right things, and yet I have severe burnout that I'm experiencing, and this just feels like they're asking me to do one more thing. I don't have it in me. What do we want to encourage or guide that person to do?
One thing that came out of the pandemic as well is a real recognition of mental health challenges that so many people have, either before the pandemic or as a result of the pandemic. And I'm sure you've seen it's now being recommended that anxiety be part of like all evaluations in primary care. I think the first thing is to really also acknowledge that there are mental health challenges and to help get people the right resources. And I think part of this is also distinguishing, am I burnt out from work, or there are other challenges going on and I could benefit from some different kind of support than I have.
And you mentioned that reaching out for help can be a challenge into itself, and yet it seems like that's a key aspect here for someone in that space.
I think that's really important, that if you have a question about whether what you're experiencing is normal or not, if you even have that thought, is there something wrong with me? Do I have burnout? Ask about it. Don't sit wondering. Don't sit with the anxiety of is there. Ask. Even if it's asking a friend or a parent or a primary care doctor or a religious person in your life, priest, a minister, a rabbi, reach out to someone and say, here's what I'm going through. Does this sound like the usual course of I'm just going through a hard time? Or is there something more? And if there's something more, what do I do about it? I have a slide that says check your battery. Are you experiencing physical symptoms? Butterflies in your stomach, headaches more than usual, fatigue? What can you do about that? Make sure you eat well. Make sure you get enough sleep. Are you feeling good? Are you feeling meh? Are you feeling crap? And take stock of where you are. And maybe if you're feeling kind of meh, you know what? Maybe adjust the expectations for what you're going to do that day or over the next week, right? Maybe adjust things down so that you can actually accomplish what you need to accomplish, rather than feeling like you've got this long list of tasks and there's no possible way you can do it. And then when you're feeling better, you can add to your list. You can set your expectations higher, adjust your expectations based on sort of how you're feeling, take stock in how you're feeling physically and emotionally. Maybe you're going to not be able to go to the gym, but you can take a walk outside because it hasn't started snowing yet, or you want to get exercise in a more creative way than whatever. But things that make you feel better. Go to your go-tos for things that make you feel better when you need a boost, or look to other people for creative ways and new ways to kind of fill your tank or recharge your battery.
I think there's another important part of this with the community and that you matter. If I don't feel comfortable speaking up, reaching out to my coworkers, say you matter enough, I'm going to have an awkward conversation with you because I care about you. That's the other half to this.
In fact, we got asked by leadership, a number of leaders in departments across our medical center, for help in asking exactly that question. How do I ask my employees how they're doing? How do I check in? How do I do this? It doesn't come naturally to everybody. And that, part of what we did was actually just help people with listening. You don't always have to solve the problem, just listen.
Yeah, nice.
And that, I think, has been really important. And I'll throw one other thing out. I think that as a country in many, many work areas, employment areas, we have a kind of work around the clock mentality. And I think we don't actually always give ourselves or others permission to take off in the ways we need to. And before this call, I was sharing with Erin and Laurel, that I had a 6-day vacation a few years ago where I didn't have internet or cell based on where I was. And it was my first experience of actually not having the news, not having, a work email.
Nice.
And so those kinds of changes of figuring out what do you need, what people working with you need, different services are going to be different on this. Some people can turn email off for the weekend. Other people are on call. But you have to figure out what your unit needs is really a key message.
Any other loose ends around burnout and the solution to it? Anything else coming to mind?
I have one intervention that I liked that I learned from some colleagues on the West Coast during the pandemic, which was at the end of the day, take 5 minutes and think about one thing that was hard about that day. Sort of think about it and then let it go. Think about 3 things that went well that day that you liked, and then appreciate those. And then call a colleague and do that with them. Takes all of 5 minutes. What was hard for you today? Let them tell you something that was hard, and then validate that sounds hard. Ask them what went well about their day, and then end your day and end your work day and go home, and then focus on home. And it gets to the balance. It gets to community when you have phone a friend. It gets to the appreciation, and allows you to sort of be at work and be present. And then when you're home, be present at home. And you're not going to be able to do that every day. But I think that sort of connects us, it grounds us, and it helps to stave off burnout, or at least ease it on certain days that are more challenging than others.
I would just want to lastly speak to the importance of hope, something as a resiliency factor, right? That gets us through tough times. I think when people come to see a physician or a care provider, right, it's one of the most important things that they can leave the visit with is a sense of hopefulness about their situation. And Laurel, I love those tips and suggestions, because I think not only do they highlight, again, some of the important factors that we can leverage to strengthen individual resiliency, but it also is about, having the conversation that allows for disclosure and vulnerability, maybe even an opportunity to be more compassionate with ourselves and others about what some of the challenges are, and to normalize those in addition to things to look forward to.
Marjorie, that interview just really had so much helpful information. And I just feel like we need to learn more, because this isn't getting better. And yet I'm hearing how Columbia recognized, hey, we have to do something about this. So I'm feeling some inspiration that there are some things we can do that can begin to counter these effects that have been around long before COVID.
What I just think is so interesting is that it's primarily related to work. That helps put it in a bucket that, like, if you're not really, don't have a lot going on, your burnout's going to be low. I thought this whole kind of notion about the 3 buckets was really interesting, right? That emotional exhaustion coupled with physical exhaustion, right? So, I mean, and we can all relate to that. We know what that's like. You're tired physically, emotionally. This kind of notion around cynicism and then how that kind of can really show up as irritability, and then just low personal accomplishment or perceived of it, right? I think those are some key points. And then I think it's so interesting that people who handle heavy workloads are more prone. And I know that that sounds like intuitive, but sometimes it's not. I would have thought that it would have been different, right? I would have thought that it would have been just the level of work, maybe not the workloads, but we're learning about burnout. It shows up in all different kinds of places. And there's really this feeling of being meaningless, right? And I think, Paul, the other thing that I'm just like, just taking all these like mental notes about this is that the connection between burnout and depression, that piece that there's this point where exhaustion and loss and where that crosses into depression.
Yeah, when you're talking about the high achievers more prone, and I think what we tend to do is, well, if I just work harder, I can get myself out of this, which is maybe just exactly the opposite we need to do. And how we learn that there are these drivers, these different indicators that I'm going down the slippery slope, and there are things I can do to pull myself back out of it. And I want to speak to, I think, here at Psych Hub, that we do practice these things, this idea of really demonstrating we value the people here and what they have to say and do.
Yep, that coupled with self-care, right? This is what we've learned. Self-care is just how you can address it, and both at an individual level and at a company level, right? How can organizations link their arms together and do self-care themselves? And that self-care too, it looks different, right? It just, for you, it might be very different for me. And for different people, it all means different things.
Yeah, I think it's time to experiment. Again, this idea of COVID brought about a disruption, and disruption invites an opportunity to experiment. We don't have to do things the same way we always did before.
I love that. What's that expression? The same behaviors yield the same results. So it's like, if you want change, you got to make change. I think that's...
Got to do something different.
Yep, exactly. I like also this idea that think about what went right and what went wrong in your day, and then let it go. So if you're focusing on something that went wrong, think about it, and then think about 3 things that went right, and then let it go. Paul, I don't think we're going to solve burnout. I think burnout's always going to be with us. I also think that there's some good that comes from working hard, that you get to burnt out, that you take a vacation and you recharge. But we all got to be aware, and there's a tipping point where it becomes detrimental and wreaks havoc. And so I appreciate that you took the time to have those conversations with those amazing people. To all of our listeners, take care of yourselves and take care of those around you. Let's be empathic and patient with each other, because as we know how burnout shows up, people might behave in a certain way and we don't necessarily understand why, but being compassionate can go a long way.
Yeah, that old quote, this one's going to take a village.
Have a good week, everyone, and looking forward to seeing you all next week when we talk about relationships.
Thanks, Marjorie. If you'd like to reach us, you can do so at podcast@psychhub.com. To be notified of new episodes, don't forget to like, subscribe, or follow wherever you're listening. And reviews are so helpful, so please do leave one if you can. It'll allow others to find us and join along. Coming Back Better is executive produced by Jacob Morrison. It is produced and edited by Juliana Castro. The series was developed in collaboration with Linda Rosenberg, Carla Cantor, and Kristen Watson from Columbia University Department of Psychiatry, and Manisha Shah, Dr. Frank Drummond, and Amy Rushton from HCA Healthcare. Research is assisted by Melissa Leaf. Show artwork was created by Arnella Jangoli and Ashton Smith. Audience strategy is by Alyssa Fackler, Sarah Hale, and Alyssa Yarama. A very special thanks to Andrea Rollback, Trevin Stegall, Evelyn Valentine, Kaylee Sneed, Julie Plummer, Thad Thomas, Paul Kay, and Elizabeth Roosevelt. Coming Back Better is a co-production from Psych Hub and Columbia University Department of Psychiatry and is brought to you by HCA Healthcare. I'm Paul Dager, and my co-host Marjorie Morrison and I thank you for joining us. See you next week.